surfaces, three borders. The shaft. See here, this is the medial surface, is triangular above, narrow below. See, this is the lateral surface, it passes obliquely. The lateral surface and the medial surface is separated by a ridge. This is called the tibial crest or crest of the tibia. See, this is the posterior surface is flat. The upper side you can see the rough lines. This is called popliteal lines. Below this, this is the area for the deep rigid flexor muscles. Here a muscle be attached, that is called popliteals. If you take the border, this is the medial border, is thick and rounded. See, this is the anterior border, is formed by the tibial crest or crest of the tibia. It extends upward. It ends as a protruded portion, that is called as tibial tuberosity. See, this is the lateral border is concave. When it joins the fibula, between these two, it is forming an arch. That is called as tibiofibular arch. Right. Then if you take the proximal extremity, it is made up of two condyles, a tuberosity and a spine. The condyles are concave structure. Usually the condyle means a cylindrical article area. Here the menisci will be attached. That's why it is concave structure. One is called as medial side, is called medial condyle, lateral condyle. On the lateral condyle, lateral side, you can see the fibula is fused. See, this is the rudimentary fibula. It is fused in the case of ox. In the case of ox, that is a separate bone. The bone is not here. This is a separate bone. This fused here. Then between the tuberosity, it is always anterior. That's why in the book it has given as anterior tuberosity. It is not anterior tuberosity. It is a tibial tuberosity. It is located in the anterior position. That's why it is called as anterior tuberosity. Between the anterior tibial tuberosity and the lateral condyle, you can see a groove that is called sulcus muscularis, through which the tendon of the complex muscle passes. The posterior side, you can see a notch is there. This is called as popliteal notch. Then, if you take the spine will be in the center between the two condyles. The articular surface, smooth surface, extends on the sides of the spine. The spine is divided into two in the upper part, that is in the summit region. It is called as bifid appearance. On the either side of the spine, you can see the depression. This is one depression. This is another depression. It is for the attachment of cruciate ligament. In the lateral to the popliteal notch, you can see the small tubercle that gives attachment to the coronary ligaments. We have studied the stifle joint in the orthology. The tibia and the fibula is connected by a ligament that is called cruciate ligament. One will be anterior cruciate, posterior cruciate. The menisci will be kept in position by a ligament that is called coronary ligament. It has lateral side has 3 coronary ligaments. Medial side has 2 coronary ligaments we have studied. If you are having any doubt,